Good afternoon, everybody. Dimitri from Total Physical Therapy, day one, virtual physical therapy, March the 16th. Just wanted to show you guys a little bit of what the virtual physical therapy sessions will look like. We're going to be using the Zoom platform, and basically, I will see you, you will see me. This is what you're going to see in the background. Obviously, we'll be moving around a lot, but simply put, the assessment process is going to be obviously an extensive conversation between you and me. Obviously, Lauren is doing this as well. If you look at her feed on Facebook and Instagram, you should see this as well, just a different background. But simply put, the assessment would be about 90 minutes long. Each session would be an hour. Obviously, this is all fluid and may change. It could be more if necessary. And simply, we're going to have a conversation about what's going on, what your pain is, what your complaints are, what you've been doing in the past. Obviously, if you're an existing client, this is just a continuation of what we've already been doing, minus the hands-on. But with regards to the assessment process, outside of the extensive question and answer session and the discovery of what's been going on with your history and what you've experienced so far, what it actually looks like now would be, after the conversation, we'd go through a movement assessment. Now, we utilize a combination of a few techniques, the main one being the SFMA, the Selective Functional Movement Assessment. And simply, it's just a lot of moving around, looking at your trunk rotation. So, we would have you bend and arch and stand on one leg and walk, turn, twist, move your arms around, move your legs around. And that will give us a ton of information on where your restrictions are, where your pain levels are, where your poor movement patterns are. We would then go through an assessment of how you get on the ground, get up off the ground, how you stand on one leg. And then we would look at breathing mechanics and discuss what occurs when you breathe poorly and when you breathe well, and what happens to your breathing when you stand on one leg compared to the other, what happens when you're on all fours, what happens when you're on your back. We would go through a lot of different things. And then we would also guide you through certain movements based on the assessment and the information that we gather. So, we could have you on the ground with your feet up on a block, as you see here, doing a few things. We could have you on the ground here and go through certain movements and functional stability drills. And there's lots of different options for us to look at, and there's a lot that we can do without putting our hands on, folks. And this is something that I would also record via the phone, on the screen, and or myself, and then I would send it over to you via Google Drive. So this way, everything we do, or everything that I will have you do as a patient, is on video, and I'm doing it for you in this case. Usually I would record you, and then that video goes to you, you own it, and you can execute these movements at home. And those movements ideally will make you feel stronger, breathe better, move better, and ideally have less discomfort with those movements. So this is something that we can adapt on an as-needed basis. You do not need much of anything other than this device and some space. We do have kettlebells that we use, foam roller that I have. You can have a lacrosse ball if you don't have one of these at home already. The kettlebell, if you don't have at home, which some of you do, some of you don't, that could be replaced by a gallon of milk if you haven't run out yet, or a rock or a boulder outside the house, a box. I mean, we can get a little creative with that. And then we would go through the motions of going through these movement assessments and movement treatments. So if you have any questions, please DM me, email me, Dimitri, Dimitry, @total-pt.com. You can find me on Dimitri, Dimitry, on Instagram. And Total PT and J is on Instagram as well. And on Facebook, it's Dimitri Polikov, my name, personal, and Total Physical Therapy on Facebook as well, would be the business page. So give us a holler, let us know. We're going to be getting after it today with several clients, and continuation of treatments that have been done in the clinic. They're going to be continuing today, and then we'll have new folks coming on the system this week, because we've got to keep things moving. Things will change, but some things don't have to. we have to kind of adapt and, adapt and survive. So we have to give this a go and see how it goes. We've done really well in the past. Like I said, we've had clients from Virginia and Texas that have gone through a series of 3 to 6 sessions. And they've done incredibly well, great results. And then we've connected them with individuals in that area to continue the treatment once we kind of got them going. So this is something that has proven successful in the past, and it's silly not to take advantage of it now when the results can be really good. So email me, call me, 908-268-1913 with any questions. And hopefully we'll be seeing some of you in this little virtual land pretty soon. All right, take care, stay well, stay healthy, chin up, and we'll talk to you soon. See ya.